Good afternoon, everyone. It's 2 o'clock and time to start today's briefing. On our panel today, we have Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Kirsten Johnson, Commissioner of the Milwaukee Health Department, and Darren Roush, Health Officer and Director of the Greenfield Health Department. Mayor Barrett, you're up first today.
Well, thank you very much, Sydney, and good afternoon, everyone. I think all of us are looking for progress and for some positive signs now that we're basically 14 months into this pandemic. And I'm happy to report that we're starting to see some positive signs, including some events we all love being planned for this summer, because every single one of us wants to get life back to normal, whatever the new normal is. And one of the normal parts of summer in Milwaukee is Summerfest. And so I'm pleased that Summerfest announced its September lineup today, and State Fair is moving forward in August. It's also great to see the Bucks winning with fans looking on, and I'm waiting for the Brewers to come home so they can win some more games here as well. And all of this is occurring and all of this is happening because we want to get back to normal. We've had a long stretch of restrictions. It's been frustrating. It's been challenging. I am pleased how our community has come together. And as we all play a part in putting the COVID-19 pandemic behind us, it's important to remember, of course, that vaccinations are a huge part of our collective efforts. And so are the basic public health precautions of distancing and masking. Since it's Thursday, I want to share that our gating metrics have remained steady from last week. We have not gone in the wrong direction. We'd like to go faster in the right direction. We remain in the high transmission category for the number of COVID-19 cases per 100,000 people, and in the moderate transmission category for percent positive cases. I want to see us drop from that high transmission category, and I also like to see us drop from that moderate transmission category for percent positive cases. But things are going well. But let's stay focused on our goal of stopping the spread of COVID-19. We can see from around the world that although we're making progress here in southeastern Wisconsin and Milwaukee in particular, that's not the case around the world. And it's a human tragedy to see what's going on in places like India right now, which should be a very, very sobering reminder to all of us of how serious this pandemic is and how we are not out of the woods yet, and that we have to keep this in mind as we take our steps to get back to life as normal. And we can't get ahead of ourselves. In the last 2 days, the Milwaukee County Medical Examiner lists 2 more COVID-related deaths. And that's a sad reminder that the danger remains real and that it's present. We can't let our guard down, even as we start taking these steps to get life back to normal. And again, as I said, the vaccination issue remains a big part of it. The city continues to offer quick, easy, and free vaccinations for Milwaukee residents at the Wisconsin Center and at the Northwest and Southside Health Centers. Last Sunday was the final Sunday for vaccinations at the FEMA mass vaccination site at the Wisconsin Center. This was done, quite honestly, because the demand wasn't there on Sundays for people to come in. And FEMA rightfully wants to put its resources in the places where there is demand. But the Wisconsin Center remains open. It is now open Monday through Friday from 9 a.m. to 5:30 p.m. And it's open on Saturdays from 9 a.m. to 3:30 p.m. until the end of the month, until May 28th, actually. As of today, the vaccination rate for Milwaukee adults who have completed their vaccination series, meaning both vaccinations, if it's a 2-shot or the J&J, is at 35.2%. So it continues to rise. We have to get higher, though. And hopefully, as young people get vaccinated, we'll see that number continue to grow. But let's keep up our efforts. In addition to the sites at the Northwest Health Center, the Southside Health Center, and the Wisconsin Center, we continue to take this to the people in the neighborhoods, because we know that there are some people who are very, very eager to get this at the onset. We know there are others that don't have the luxury or the ability to get to some of these sites, may not be as anxious as others to get the shots, but are still open to getting the shots. And so we want to make sure that we're taking it into the neighborhoods, into places where people go to school, where they go to work. So today, public vaccinations will be administered at Job Corps, which is located on the northwest part of the city of Milwaukee at 6665 North 60th Street from 9 a.m. until noon, and at St. Martin de Tours which is located at First and Burleigh from 1 to 3 p.m. Tomorrow, on Friday, May 7th, the Mexican Consulate, which has been a great partner to us and is located at 1443 North Prospect Avenue, will continue its weekly vaccination efforts from 3 to 5 p.m. Saturday, vaccinations will be available at Walker's Point Community Clinic located at First and Bruce on the south side from 9 a.m. to noon. The Children's Outing Association Golden Center located at 23rd and Burleigh from 9 a.m. to 1 p.m. And at Emmanuel Presbyterian located on the east side in downtown from 10 a.m. to 2 p.m. And Emmanuel Presbyterian is located at 1100 North Astor. So you can see we're doing it in all parts of the city. In the near downtown, we're doing it on the south side, we're doing it in the central city, we're doing it on the northwest side, because we know how important it is to get the vaccinations into the community. And that's what we're committed to doing that. Finally, on Sunday, May 9th, the Salvation Army Emergency Lodge, located at 1730 North 7th Street, will be offering vaccinations to the public from noon to 2 p.m. So again, we're continuing this outreach effort, and we want people to take advantage of this. This is all for the safety of our residents, for their families, and the rest of the people in the community. And with that, I'm very, very pleased to turn it over to County Executive David Crowley. Mr. County Executive.
Thank you so much, Mayor Barrett, and good afternoon to everybody. Glad to see everybody is tuning in, but I also want to make sure that folks understand that I'm extremely happy because we are announcing that all 5 Milwaukee County-owned senior centers will be reopened as early as May 24th. So these senior centers, they've been closed since last year due to COVID-19. And as we see vaccination rates rise, we want to offer our older adult population safe places to socialize and receive vital services. And, Milwaukee County, we recognize that senior centers play an important role in serving our elderly population, many of whom have struggled with isolation during these unprecedented times. So our Milwaukee County Department of Aging will begin reaching out to customers to discuss our facility's code of conduct and share the guidelines that will be in place to mitigate the spread of COVID-19. And we are committed to the health and safety of Milwaukee County. We'll continue to monitor and practice safety measures that mitigate COVID-19 in these spaces the way we have in other government buildings, because we want to make sure to ensure safety and support for those who utilize our senior centers. Additionally, I'd like to share that we have expanded the special bank sick leave time for Milwaukee County employees as of May 2nd. Since many schools have began to do in-person learning, we've noticed an uptick in employees needing to take off work to care for a dependent who is exposed and must be quarantined. And we believe it's important to provide this support to our employees needing to take time off for a quarantine dependent. But I will say that this change is not tied to FMLA. It's simply another access point granted to employees to care for their loved ones during these unique times. And we really hope that this change helps our employees take care of their families' needs. And we want to encourage other employers to consider similar policies to alleviate any additional stressors individuals are facing, particularly with dependents getting exposed and trying to do the right thing to keep the rest of the community safe. And lastly, I'd like to acknowledge that it is National Nurses Day, and I want to give a much-deserved shout out to all nurses throughout Milwaukee County. Nurses have been on the front lines in this fight against COVID-19, providing care and comfort to everyone in our community, to a lot of us in our community. And so we appreciate your hard work, your dedication in keeping Milwaukee safe, healthy, especially through this pandemic. And we would not be where we are today without you. So I want to personally say thank you for all that you do for this community. And with that, I'd like to hand it over to Dr. Weston. Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we are seeing an increase or an average of 118 new cases a day and about 2 deaths every 3 days. We did see a decline in vaccinations per week, once again, from 7,300 last week to about 5,900 per day this week. We also added a new view to the vaccine tab on the Milwaukee County dashboard. So this shows trends in first doses. So while the figure that's been there showing overall doses is still certainly there, that view is a representation of vaccine site activity in our community. While this new view of first doses gives us a better understanding of how many people are actually getting vaccinated in the community. And those numbers are telling, whereas at our peak, we had nearly 6,200 people getting their first dose each day, we're now at about 1,700 people. And this highlights the need for our current shift in vaccination strategy from mass sites over to smaller local efforts and more focused messaging to those who feel they need a bit more information about the vaccines. And that information, that good news on vaccines keeps coming. From the duration of immunity, from the vaccine to the higher than expected effectiveness, to the safety in pregnancy, we're seeing more and more promising, encouraging facts on the effectiveness and safety of the vaccines. And the most latest promising news is from a study out of UW Health in Madison that evaluated CDC data. And they found that an unvaccinated person is 1,000 times more likely to get COVID than someone who's fully vaccinated. So to those who are unvaccinated and have not yet had COVID, you're lucky. But this data shows that you're also on borrowed time. Now, to those who are not yet eligible, it's anticipated that early next week, the FDA may authorize the use of the Pfizer vaccine for children aged 12 to 15. Now, this has been anticipated by and will be a great comfort to many parents of children in those age groups. So up until this point, the best way to protect your children was by the standard safety measures, masking, distancing, as well, importantly, of course, by getting vaccinated yourself as a parent. Now, in Pfizer's research trials for this age group, they studied the vaccine on over 2,000 children, 12 to 15, and found it to have an efficacy of 100%. That's to say, not a single vaccinated child studied contracted COVID. The results couldn't have been better. So adding somewhere on the order of 5% more to our population of those nationally eligible for vaccination will be a great step toward decreasing the burden of disease from COVID. And that brings us to the topic of herd immunity. We've heard a lot about herd immunity lately. What is it, whether we can reach it, and how to get there? So it's important to start with the basic concept, and that is that the more people we get vaccinated, the harder it is for the virus to spread. So if I have COVID and I'm in a room with 3 vaccinated people, the virus has nowhere to go. It ends with me. And on a larger scale, the more of the population that we can get vaccinated, the less places the virus will have to go, and the less spread of that virus there'll be, and also the less mutation of that virus there'll be. So this will drive our COVID numbers down, and we're seeing that. One of the most obvious examples is with hospitalizations of those 65 and over. So nationally, about 83% of those 65 and older have received at least 1 dose of vaccine, 83%. And those rates of vaccination, as those rates of vaccination have gone up, the hospitalizations in that age group have dropped. So during our national peak in January, when we had more COVID than any other time in the United States, 53% of those hospitalized were 65 and older, 53%. Now it's dropped to 29% of hospitalizations. So the end number of herd immunity is difficult to pin down, what that perfect percentage is. But what's important is that the more people we can get vaccinated, the more we can drive down the burden of disease and get back to our normal lives. As vaccinations increase and disease burden drop, we can take gradual, measured, but purposeful steps toward normalcy and openness. Now, we also added another new view to our Milwaukee County dashboard, and it's under the Municipality Trends. And so you can see what percent of the population in each municipality has received at least 1 dose of vaccine. So looking at this, you can better understand how vaccine is being accepted, being pursued by members of your community. Now, importantly, of course, no community has vaccinated all of their eligible residents. And as we talked about, regardless of the percent vaccinated in your community, more is better. More is safer. So for those of you who are watching this and have been vaccinated, understanding vaccination rates in your community and talk to your family, your neighbors, and your coworkers. Vaccination is not a taboo topic. We live in a world dominated at the moment by COVID and conversations about COVID. So discuss your experiences, share your stories, help to protect your family and help to protect your community by getting more people informed and more people vaccinated. Thank you and stay safe, and I'll pass it to Commissioner Johnson.
Thank you, Dr. Weston. The Milwaukee Health Department continues our effort to vaccinate the community with our mobile and pop-up vaccination events. As Mayor Barrett mentioned, as of today, over 35% of Milwaukee residents are fully vaccinated and over 42% have received their first dose. Bringing vaccine to where people are is the next step in getting more shots in arms. If there's an event or a business that would like us to vaccinate their staff, please call our hotline at 414-286-6800. Our team is ready to bring the vaccine to you. Tomorrow, Visit Milwaukee is hosting Hospitality Vaccination Day at the Wisconsin Center. From 9 a.m. until 5 p.m., we are encouraging hospitality workers who have not been vaccinated yet, everyone from bartenders and servers to hotel concierge and museum docents, to go to the Wisconsin Center. Walk-in vaccinations will be available, and Visit Milwaukee will also be distributing local hotel and restaurant gift cards to those who take advantage of this event. In addition, 2 lucky winners will be awarded a $500 prize when they return on May 28th to receive their second dose. As Mayor Barrett mentioned, on Saturday, we are hosting 3 mobile vaccination clinics throughout the city. So there are multiple opportunities to get your shot this weekend. All of our sites are walk-in and no appointment is necessary. They are all open to the public as well. This morning, Summerfest announced their headliners for the festival, which is scheduled for September. We are excited to see the return of live concerts and festivals to our city. And the Milwaukee Health Department has been working closely with Summerfest on their safety plan, so we can ensure that concert attendees are able to enjoy the festival safely. I also wanted to take a minute to address the questions regarding the health department's involvement with contact tracing in Milwaukee public schools. We have been working closely with MPS administration to ensure families are notified of an exposure to a positive case. The health department is providing contact tracing for identified students who meet the CDC's definition of a close contact of a positive COVID-19 individual in the school setting. We hope this assistance will alleviate some of the burden on MPS staff and are happy to continue to work collaboratively with our school district. Finally, I want to acknowledge National Nurses Day and thank all City of Milwaukee nurses, but specifically our public health nurses who worked so diligently over the past year and have truly put their heart and soul into fighting this pandemic. I would now like to hand it over to my colleague, Darren Rausch.
Thank you, Kirsten. I appreciate that introduction. My name is Darren Rausch from the City of Greenfield Health Department, and I'm here today just to provide an update about the epidemiological data that we've been seeing in COVID-19. As many of the other speakers have mentioned, we are heading towards a level of normalcy and towards a return to normal. And there's some both good and positive things in the data this week, as well as some concerning data trends that continue. We're continuing to see overall a plateau to a slight decrease in COVID cases throughout the county. Predominantly, we see that plateau in the city of Milwaukee when we look at the whole population, while suburban data shows a continued overall slight decrease again this week. Primarily, we see a lot of disease activity among children 18 years of age and under, and that's been more pronounced in the city of Milwaukee, and that trend has been more pronounced than the population as a whole. So these increases are pretty significant in the city of Milwaukee for kid cases of COVID-19, starting at approximately early to mid-March with a small blip downward, but generally continuing an upward trend. And the growth in cases appears to be primarily in the Black or African American community, but certainly we're seeing increases across all population subgroups for youth. And also the increase seems to be largely tied to kids 15 through 17 in our community, but we do see increases amongst youth throughout the 0 to 18 age range. And in comparison, suburban communities are continuing to note a decrease over the last couple of weeks for children under the age of 18. So these are trends that we're monitoring quite closely because they're very telling about what disease activity is happening in our communities. So now let me go ahead and share the data and we'll see what the graphs show. So here up first is the graph of new cases of COVID-19 throughout Milwaukee County for the entire population. And this is the plateau I'm speaking of. Really, for the last couple of weeks, we've seen pretty flat rates for the city of Milwaukee's 7-day average. And correspondingly, during those last couple of weeks, we've seen a decrease in the suburban communities. When we switch now and look at the kids 18 years and under, this is the telling increase that I noted earlier. We saw generally some increases starting in early March in both the suburban communities and the city of Milwaukee, but that increase is much more pronounced, the orange line, for the city of Milwaukee than it is for the suburban communities, which seems to have peaked amongst kids a couple weeks ago and have been on a slight downward trend since. Going back to the full county report, again, we've talked about this in the past. Deaths have been an indicator that has been nearly non-existent over the past couple months here, and that's a very good sign. Averaging less than one a day is a very positive sign, meaning that we have high vaccination levels in our oldest and more vulnerable populations. We've been tracking the transmission rate and that reproductive number of COVID for many, many months. And this week we are again approaching 1 for that transmission rate in the entire county. We're at like 0.97 is the number. And we see different trends when we compare the city of Milwaukee on top to the suburban communities on the bottom. In the suburban communities, we've been largely below 1 for a couple weeks. And in the city of Milwaukee, we trended down, but have largely gone back up. And that number is just slightly above 1 at this point. And this is something we want to track because the transmission rate is indicative of transmission in the county, and we want to keep that number very small. Reflecting on demographics, I just want to continue to highlight, much like we see in the kid population, we're seeing increases across all age distributions and race and ethnicities. But the important thing I want to point out is that we're seeing a growing in the number of cases amongst those under the age of 18, which is consistent with the report that I shared earlier in the kids report. But we're also seeing an increase transition in cases among the Black or African American community. And we can kind of see that starting here several weeks back, where this curve has increased, and soon I would anticipate the Black or African American community will have more cases than the Hispanic community. And that is something that hasn't happened since very, very early in the first couple months of the COVID pandemic. Just kind of scrolling down here to talk about testing. Testing, I reflect, has been up over the last couple weeks, and that probably speaks a lot to the increased transmission in the community. We see that overall, we were fairly flat for a number of weeks and decreasing, but the last 3 weeks were an increase in testing, and I would expect a similar trend for this week when all the data comes in. We're continuing to see some positives in testing. There's a lot of testing availability, and with that testing availability, we're starting to see continued percent positives at a low rate. So that's very good. We see the trend here is largely flat for percent positivity, and that's a positive sign. Lastly, I'll leave you with today just a glimpse of where we've been with COVID, again, over the last 15 months. So this this figure shows areas of high incidence of new cases countywide between March of 2020 and early May of 2021. And I show this because this is one picture of what we saw in total over the past year, but more importantly, I want to contrast that with what we've seen in the last week, or last 2 weeks rather. Over the last 2 weeks, continuing a trend that started last week, we're seeing a lot of activity throughout the city of Milwaukee and into the northwest and north part of the city. So a lot of our areas of our peak activity are in and within the city of Milwaukee, with a little bit of activity here in Cudahy and some areas of orange down in the southern suburbs, but certainly very high rates in the city of Milwaukee, which I think leads to those cases in kids increasing overall as well. So with that, I'll stop sharing and I'll just wrap up my comments to talk a little bit about the expected changes in vaccine age ranges. And I know Dr. Weston hit upon these previously. A few hours ago, it came out that Pfizer and their age indications will go before the ACIP, the Council on Immunization Practices, which advises CDC, next Wednesday. So I would anticipate in next week's media briefing, we'll have an update. What we would expect is that the Pfizer vaccine may be approved at that meeting for those between the ages of 12 and 15. Currently, the Pfizer vaccine is indicated for those 16 and up. And it would be a significant change to increase the ages that this vaccine is eligible for, but it will be one that's welcomed in the public health and the medical community, because we have known for months that reaching herd immunity, as Dr. Weston mentioned moments ago, is a situation in which we need to vaccinate as many people as possible. And in Wisconsin, as you've heard us say before, 21% of our population is under the age of 18. So increasing vaccination rates amongst children 12 to 17 when the Pfizer vaccine gets expanded potentially next week is a big first step in increasing our overall vaccination levels. Like adults, children who get the vaccine, so currently those 16 and 17 years of age, who get vaccinated can safely interact with other vaccinated persons, including vaccinated grandparents without a mask. And additionally, vaccinated children in a school setting will not need to be quarantined or tested should they have exposure to a positive COVID-19 case. So like the general population of adults, kids can get a lot of benefits from getting vaccinated, and we'll carefully watch both the advance of Pfizer and their age indications, but also other manufacturers, both Moderna and Johnson & Johnson, will probably follow suit within the next couple weeks as well. And lastly, I want to certainly provide a shout out to all nurses on National Nurses Day, like other speakers have said. To echo what Kirsten said, in local health departments like the Greenfield Health Department, public health nurses are the frontline workers. And they're often the frontline workers that are doing the disease investigation, the contact tracing, and leading multiple other efforts throughout our communities. As it relates to COVID, my public health nurses have done a lot of training, coordinating, and leading the efforts of other disease investigation and contact tracing staff that have been hired specifically for COVID-19 response. And they've done an outstanding job. So thank you to all the public health nurses here at the City of Greenfield and all public health nurses for the work and efforts that you have done over the last 15 months of this pandemic. With that, I thank you all for your time and attention, and I'll now turn the briefing over to Sydney for the Q&A portion. Thank you.
Thanks, Darren. Our first question from the media comes from Courtney Sisk at WISN for Commissioner Johnson. What changes might we see to Summerfest this year as far as health safety plans? What is the health department suggesting the festival changes or implements to ensure concert goers are safe?
Absolutely. So we are making sure that masks are going to be worn and enforced. We're asking for physical distancing in some settings, recognizing that it's an outdoor setting, which makes it safer, just surely by the nature of being outdoors. Potentially looking at how beverages are served and food are served. So trying to limit interaction between groups of people who normally wouldn't be interacting with one another. But we're really, we've been working with them for a number of months, really since I started in this role, and we'll continue to work closely until the day of the event.
Thank you, Commissioner Johnson. Our next question comes from Sharon Bajenda at CBS 58 for our health professionals. Today, the Kaiser Family Foundation released data saying only 3 in 10 parents of kids ages 12 to 15 would get their kids vaccinated as soon as the vaccine is available. Some plan to wait and others plan to only get it if it's required by schools. Nearly a quarter will not allow their child to get vaccinated. Are the results of this poll concerning? Why, and what message do you want to get out to parents?
I think we saw similar trends initially when the first vaccines came out, but what we've seen as more and more people have gotten the vaccine and as more and more data has come out about the vaccines is that hesitancy goes down and the interest in vaccine goes up significantly. So I would expect similar with vaccines in that 12 to 15-year-old age group. Right now, the data that's been released is on effectiveness. They've said they were extremely well tolerated. The side effects were similar or better than in adults. But that data is still to be released. So we'll review that. We'll inform here and many other places on that data. And I think that'll instill more vaccine confidence.
Next question from Sharon Magenda at CBS 58 is for Commissioner Johnson and Mayor Barrett. Has the Milwaukee Health Department come up with a plan, or are you working on a plan for distribution of Pfizer vaccines if it does get approved for emergency use authorization for the 12 to 15-year-old age group? How do you plan to reach kids in disproportionately affected areas?
So yes, we are working on a plan. We've worked on with DHS a form to allow for children to get both doses. So parents only need to sign it once. And in addition, we are planning on having Pfizer available at the Wisconsin Center until we close on May 28th. We're also working with MPS and other schools to ensure that it's accessible for families and students.
Also, my apologies. I forgot to announce at the beginning of the briefing that Mayor Barrett had to step out at 2:30 for another meeting. So we will not be able to, we can funnel any questions to the mayor's team outside of the briefing. The next question is from Madeline Anderson at Fox 6 for Commissioner Johnson or Dr. Weston. Are plans still in place to open up a drive-through mass vaccination site, given that the vaccination strategy is shifting from larger sites to smaller walk-in clinics? What other efforts are underway to reach neighborhoods?
So yes, we are still planning. Some sort of mass vaccination sites that will be 1 or 2 days, so shorter in duration. The drive-through site that we're planning is actually going to have some incentives tied to it, and it's likely going to be in between the first 2 weekends in June. We are also all of our mobile and pop-up sites, so the church sites, the sites that were mentioned earlier today. And we are talking about how do we reach people literally door to door. So there are efforts across the city with our nonprofit partners, the FQHCs, our healthcare partners. Everyone is trying to collaborate to ensure that we're getting vaccine into communities that are harder to reach.
Thank you, Commissioner Johnson. Our next question is from Allison Durr at the Milwaukee Journal-Sentinel for County Executive Crowley. What is the current status of senior centers, open, closed, partially open, et cetera? And are you able to share more about the code of conduct? How many doses of each vaccine did the city of Milwaukee and Milwaukee County receive this week? And are those doses on track to be used this week? County Executive Crowley will have you answer the first question.
Absolutely. Great question. So our senior centers are currently closed. When you think about the code of conduct, one, we want all of our seniors to wear masks at all times. And so we are also asking that our seniors make appointments for programs, and they can call the senior center to do so. We also want to require all of our staff and volunteers to have to follow the COVID screening procedures that we have here within Milwaukee County. But we also want our seniors to, we want to ask our seniors to follow our screening questions as well. And because we want to make sure that we keep everybody safe. And that is really our goal, is to offer programming the safest way possible while trying to address the enrichment and socialization so many of our seniors need.
Thank you, Mr. County Executive. The next question for either Dr. Weston or Commissioner Johnson: how many doses of each vaccine did the city of Milwaukee and Milwaukee County receive this week? And are those doses on track to be used?
I can comment for the county. For our Kosciuszko Community Center site, we did not receive any new doses this week. That was our request to ensure that we can use up all our doses that we had from the last week and not have any wasted doses.
And I'm not sure how many we received this week, but we did have some on hand. So we may, similar to the county, have just used our current inventory for this week. And we have hoped to use as much as we can.
Thank you both. Next series of questions come from Sari Lesk at the Milwaukee Business Journal. Commissioner Johnson, how did offering vaccines at the Bucks game go? How many people took a vaccine in that environment? What did you learn through that clinic? And are any more similar plans in the works?
The Bucks won, so that was the best part of it. We did 71 vaccines that day. I think it was less than we had hoped, but I think what was most effective is the intention originally of that event was to vaccinate the staff, so the individuals who work at the Pfizer Forum. Again, sort of the bringing vaccine to where people are, and then it evolved into providing vaccine to people who are attending the game. So it was somewhat as we expected. We are planning similar events in the future. I know we're welcome back at the Pfizer Forum and the Bucks. If we'd like to come back, we will be going back at least once to give second doses and potentially more first doses. So I think what we're learning is shots in arms is it shots in arms. So every shot we get in an arm is a win.
Next question from Sari Lusk. What's the status of discussions about updating the city's mask ordinance to match the latest CDC guidance?
The mask ordinance we are looking to align the outdoor portion of the mask ordinance with the CDC guidance, but it is working its way through the Common Council process.
Another question for you, Commissioner Johnson. The city's gating criteria have plateaued, but also remain elevated compared to before the Phase 6 order took effect. We're coming up on the full month since the city said it would wait before changing the order. Where does that decision stand now?
So we are just going to hold in the Phase 6, recognizing that our numbers are continuing to decline, and we're hopeful that that trend will continue.
Final question from Sari Lusk. Is there any update on the effectiveness of vaccines in preventing transmission as opposed to a vaccinated person having severe symptoms?
Sorry, what was that question, Sydney? Can you repeat it?
You bet. Are there any updates on the effectiveness of vaccines in preventing transmission as opposed to a vaccinated person having severe symptoms?
Sure. So the data that is coming out on transmission and vaccines continues to be promising as each new study comes out. I haven't seen any brand new studies over the last week, but those that have been out show that the viral load, the amount of virus in the nasal passages in particular, which is how we spread the virus, is much, much lower in vaccinated people than unvaccinated people, suggesting decreased rates of transmission as well.
Thank you, Dr. Weston. Next question is from Rory Linane at the Milwaukee Journal-Sentinel. For Commissioner Johnson, can you clarify Milwaukee Health Department's role in contact tracing for MPS? Was there a time when the Milwaukee Health Department stopped contact tracing students and a time that this was resumed? If so, can you clarify that timeline?
Absolutely. I think what actually occurred was just a misunderstanding on roles and responsibilities. So the Milwaukee Health Department has continued to do, if a child or a student tests positive, we continue to do the full case interview and the contact tracing related to that child. If a child is exposed in school, the notification of the family that a child's been exposed happens at MPS by their COVID coordinator that is in every school. Every school has identified a COVID coordinator. There just seemed to be some confusion about the responsibility of doing additional contact tracing for students who were exposed in the classroom. So we've worked that out. And like I said, the health department will continue to do the contact tracing and will contact trace. So make phone calls for students who are truly a close contact to a positive case in the school setting.
Two more follow-up questions, Commissioner Johnson. How many people does Milwaukee Health Department have working on contact tracing now? And is Milwaukee Health Department working on establishing school-based vaccine clinics for students?
Sure. So we have about 120 people who are doing contact tracing. That's disease investigators and contact tracers. And then we are working on establishing school-based vaccine clinics with MPS and other schools, actually. We have at least 3 other schools too.
Thank you, Commissioner Johnson. Our next question comes from Joyce Garbasiak at WISN 12. Other cities are working with business entities to offer incentives for vaccination. Pro ball teams, for instance, giving free game tickets. Do you know of any similar efforts? Commissioner Johnson just mentioned incentives in perhaps the drive-through option. What might they be?
So I don't want to give away or overpromise on what the incentives are going to be for the drive-through. So I'm not able to speak to that yet, but we are talking internally about potentially incentivizing vaccine through various options. Nothing's been settled on it yet, but I know many businesses are offering donuts, a free beer, a shot, a variety of different things for people who've been vaccinated.
Our next question is from Brittany Lewis at CBS 58 for Dr. Weston. How long does Milwaukee County plan to keep the vaccine site open at the Kosciuszko Community Center? Is the county planning to host any community clinics or change strategy to smaller vaccination sites from the mass vaccination site?
So we are scaling back activities at our large site at Kosciuszko Community Center. So as of this point, we're still doing first doses, but they're only Johnson & Johnson first doses to allow us more flexibility with our staffing and our vaccine administration. Next week, for example, we're going to pull back hours somewhat at Kosciuszko Community Center as we transition to other activities. So some of that will include getting out into the community, smaller sites, visiting individuals, things of that sort.
Our next question is from Courtney Sisk at WISN 12. If Pfizer is authorized for 12 to 15-year-olds, will the dosage be different, or will there be any additional changes to the procedure when vaccinating kids?
So we'll continue to watch for guidance from the ACIP and from Pfizer as more and more data comes out on those questions.
Next question is from Madeline Anderson at Fox 6 for Commissioner Johnson. Who decides if the COVID-19 vaccine will be mandatory in schools eventually? And do you think the vaccine will be mandatory by fall 2021?
So I think the decision to make a vaccine mandatory lies with DPI and DHS at the state level, and also nationally potentially. I do not think it will be mandatory by the fall of 2021. I think one of the challenges is we're still operating under an emergency use authorization for adults, let alone children. I think that potentially could come with time, but I don't have any sense of when that may be.
Looks like we have just a couple more questions in the chat. Media reminder, if you have any further questions, be sure to get them in the chat. Another question from Joyce Garbasiak at WISN 12. After the Johnson & Johnson pause and then restart, have you noticed a drop in demand of people seeking out this vaccine option?
So just as before the pause with Johnson & Johnson, we have many people who prefer a certain vaccine. Sometimes it's naturally they prefer Pfizer because they're 16 or 17 and that's the only vaccine they can get. Sometimes they prefer one shot over two. They have brand preferences, whatever it is. But even since the pause, we've still seen quite a few people that seek out and prefer the Johnson & Johnson vaccine.
Thank you, Dr. Weston. Our next question is from Chuck Hornbach at WUWM for County Executive Crowley. The national eviction ban remains in place, but may be in jeopardy. Please talk about, from a health perspective, if possible, the importance of keeping the eviction ban in place.
Well, we know that housing is one of the social determinants of health. And so when you think about what has been happening in this community around evictions, we've seen it take a detrimental toll in this community even before the pandemic. And I think that keeping this ban in place will help to ensure safety. But I think it's also important that we let folks know that dollars are still available to help keep people within their homes. And so they can still contact organizations such as community advocates to apply for housing assistance, eviction prevention dollars. But I think this will have a huge toll on us. We've been doing everything that we can to reduce our homeless population out on the streets. And for us, it's about making sure that we continue to keep the health of our community at the forefront. So I think this is extremely important for us to continue to pay attention to, but we need as many people as possible, if they're facing evictions or behind on their rent, that they apply for eviction prevention dollars if they can.
We are coming up on the last question in the chat from Rory Linane at the Milwaukee Journal-Sentinel for Commissioner Johnson. When you say Milwaukee Health Department contact traces students who are truly a quote close contact, do you use the CDC definition of close contact? Does that mean Milwaukee Health Department does not do contact tracing phone calls for students who were in a classroom with someone who tested positive, but may not have been within 6 feet for 15 minutes?
Correct. So we are using the CDC definition of a close contact, which is within 6 feet for 15 minutes or more over a period of 24 hours. So we are not calling or doing contact tracing phone calls for students who are in a classroom with another student who may have tested positive. And this is part of this challenge has been MPS policy is to quarantine an entire classroom after a positive case. which is not the guidance that we follow through the CDC. So that's part of this. Again, I think there's just been some confusion about roles based on policies and the true CDC definition of close contacts.
That appears to be the final question in the chat. Thanks everyone for joining us today. We'll be back here next week. Have a great
Thanks,
afternoon.
everybody.
Thank you.